In this video, we will demonstrate how to identify and manage an outbreak of illness with the assistance from the health department. An outbreak is defined as an increase of disease occurring within a specific population at a given time and place. In order to be able to quickly detect this increase, a daily surveillance program should be in place in all day nurseries. With the early identification of an outbreak, control measures can then be implemented quickly to control and prevent any further spread of illness. When the number of cases returns to the baseline levels of illness and the necessary period of time has passed, the outbreak will be declared over and normal routines can resume. Durham Region Health Department's role is to guide and assist your center through the outbreak process. As the children enter the day nursery daily, staff should meet and greet them at the door to observe the health of each child. When a child is obviously ill, do not allow him into the center, as it may affect others in the center. Remind the caregiver of your center's illness policy. Record any illnesses promptly on the day nursery routine illness surveillance form. The supervisor should be reviewing these forms after most of the children have arrived for the day in order to assess the overall health of the center. Once the supervisor recognizes that there may be a sudden increase of illness with similar symptoms, she should contact the health department as soon as possible and speak with a communicable disease public health inspector, or CDPHI. This consultation and review of daily surveillance information will determine whether an outbreak is occurring. If an outbreak is in fact declared, the supervisor will be asked to immediately post outbreak signs at all entrances. Any center lacking outbreak signs will be provided with enough for all entrances to the day nursery. If necessary, the CDPHI will provide the center with outbreak kits and review their proper usage. Separate line listings of ill staff and children must be prepared in a timely manner and forwarded to the CDPHI. Updates to these line listings must be provided daily for the duration of the outbreak. During this visit, the CDPHI will review with the center the relevant outbreak control measures in the Infection Outbreak Control chapter of the We Care Manual. During the outbreak, implementing infection control measures will help to control and prevent new cases. These must be implemented immediately upon declaring an outbreak in order to make a difference. Such control measures include isolating or cohorting children when they are ill, increase the frequency of hand hygiene, which can include hand washing or hand sanitizing, using gloves whenever there is a possibility of blood or body fluid exposure, increasing the frequency of environmental cleaning and disinfecting, discontinuing group water play and shared sensory play activities, canceling community events and restricting visitations to the center, not allowing for new admissions or transfers of children. All of these, and perhaps more measures, should be discussed with the CDPHI for relevance and significance. When outbreak kits are ready for pickup, the CDPHI can arrange for pickup and submission to the lab. The lab will contact the health department with the results of the tests. If the causative agent has been identified, then the CDPHI may adjust the exclusion period and length of outbreak accordingly. Meanwhile, the supervisor should be sending updated line listings daily to the CDPHI. All outbreak control measures should be maintained until further direction is provided by the CDPHI. When the specific number of days depending on the organism has passed with no new cases, the CDPHI will be able to declare the outbreak over. At this point, the supervisor can remove the outbreak signs from all of the entrances. All regular routines, including daily surveillance, must continue. Be vigilant, stay informed, Let's manage our outbreaks together.